Our goal is to make sure that your post-operative recovery is very comfortable and goes nicely and smoothly. Your preoperative appointment date will be roughly 2 weeks before your surgery date. Now on that day, you're going to meet with a medical assistant who's going to go over with you all the information that you need to know before your surgery day. For example, we'll go over any preoperative studies that you may have already had done and order any additional studies that you need to have done. For example, any woman having breast surgery who's over 35 years of age should have a mammogram on file that's within at least a year old. Any patient having surgery who's over 50 years of age or having over 8 hours of surgery should have cardiac clearance, just to make sure that your heart's in good condition to undergo either a lengthy procedure or a procedure just because of being over 50 years of age. Okay, so those are some basic things. Now, of course, lab work will be depending on what other medical problems you might have, for example, diabetes or steroid use or autoimmune disorders or even anemia. So we'll customize lab work based on those types of things. But in general, most patients are healthy, don't have any major medical problems, and probably aren't going to require any laboratory work. In addition to that, you'll be signing your consent forms for your various surgeries and going over medications as well. So we'll be looking over which medications you're currently on, which medications should you be stopping before surgery. For example, we don't want any NSAIDs, non-steroidal anti-inflammatory medications, at least a couple weeks before surgery. If you're on any weight loss medication like phentermine, that needs to be completely stopped at least a week before surgery. These are just some examples. The other medications that you usually take on a daily basis, whether it's thyroid medication or diabetes medication or hypertensive medications, those are perfectly fine. You should continue to take them up until the day of surgery. Of course, like any other time, you should avoid eating and drinking 8 hours before your surgery time, okay? Usually that morning you can get up and take just your medications with a sip of water and then go on to the surgery, okay? Lastly, you'll be getting your prescriptions. Now, we have multiple medications that are going to be given. Our postoperative medical regimen includes taking narcotic, which is your hydrocodone, but in addition to that, we have 2 additional medications we help with postoperative pain. The first is Celebrex, which is an anti-inflammatory. The second is gabapentin, which is a pain medication that specifically helps nerve pain. Okay, those 2 can be used synergistically with the narcotic. In addition to that, you'll get a medication for nausea in case you have nausea and an antibiotic as well. Okay, so those are medication prescriptions you'll be getting either by hand or they'll be electronically sent to your pharmacy. And finally, our medical assistant will go over any other last-minute tips that you might need to know before your surgery day, which will be coming up very soon.